Hi everyone, so welcome back to Nursing Guru. So today we are going to discuss about the important questions and the question pattern of the child health nursing or pediatric nursing for GNM students. So today we are going to discuss about the question pattern of the GNM examination. So at first you will be having MCQ true or false, fill in the blanks and give the meaning. This question will be carrying 1 marks, and then next we will be having short answers, and these short answers and short notes will be carrying 4 or 5 marks. Then at last you will be having long essays, and these long essays sometimes it is divided into short answers. So now we are going to discuss about the unit wise important questions. So as we all know, according to GNM syllabus, we are having 7 units. So under that, the first unit is all about introduction to child health nursing and pediatric nursing. So under that, you will be having 3 important questions. The first one is vital statistics, and the second one is trends in pediatric nursing, and the third one is role of nurse in pediatric nursing. Next, we will be move on to the second unit. This second unit is all about the growth and development of child. So this unit itself is very important. You have to study it thoroughly. Sometimes it can ask for 4 marks, sometimes it can ask for multiple choice question, and sometimes it can ask for fill in the blanks. And this unit as well as is very important for your practical exam also. Next is unit 3. This unit is all about sick child. So under this you will be having few important questions. These are hospitalization of sick child, management of sick child, and some procedures also will be there. This is important for your practical exam also, like nasogastric tube feeding, colostomy irrigation, Ryle's tube, etc. Now unit 4. So unit 4 is all about disorders and diseases of a child. So here we are going to see which all the disorders a child will be having. So under that, the first one is failure to thrive. So failure to thrive means when a child will not gain weight according to their age. And the next will be tonsillitis, otitis media, then helminthic infections, enuresis, it means bedwetting. So from unit 4, these are the few important questions. Now unit 5. So unit 5 is all about congenital anomalies. So congenital anomalies means the child will have the disease from birth or at birth. So under that we will be having few important questions. So the first will be hydrocephalus, the next spina bifida. So this question you are going to write definition, types, causes, sign and symptoms, clinical manifestation or diagnostic evaluation, then at last management. So under management also you are going to write so medical management, surgical management and nursing management. So under nursing management, if the surgery has done means you have to write pre-operative, intraoperative and post-operative. So this is all about the how you are going to write the questions. So after that, hydrocephalus, spina bifida, then next we will be move on to the skeletal defects. So this is related to the anencephaly and craniosynostosis. So under craniosynostosis also we will be having few types. So these also you have to going to mention in the examination. The next cleft palate, ASD, VSD, PDA, TOF, these are the few important questions from this unit. Also you will be having few chromosomal abnormalities. So under that, the two will be very important. The first one will be Down syndrome and the second one will be Turner syndrome. So next we will be move on to the unit 6. So this unit 6 is all about child with various diseases and disorders. So under this you will be having few important questions. So after that, the first one is nephrotic syndrome, then the second one is acute renal failure and the chronic renal failure. So sometimes they are asking the difference in between acute renal failure and chronic renal failure. Then next asthma, pneumonia, rheumatic fever. Then next we will be having some kind of blood disorders. So under blood disorders, 3 will be very important: hemophilia, thalassemia and anemia. So under anemia you have to study about the types of the anemia also. So after that, burns, rule of nines, poliomyelitis, and at last pre and post operative care of a children. Then last unit. So last unit is all about child welfare services. So under that you will be having ICDS. The full form of ICDS is Integrated Child Development Services. So with that you will be having midday meal program, daycare center, child act. So from unit 1 to unit 7 we have discussed the important questions of childhood nursing or pediatric nursing. So far we have discussed about the important questions and the question pattern of the childhood nursing for GNM students. So I hope it is clear for everyone. So if you have any doubt, please do comment here, and thank you for watching. All the best for your examination. Thank you so much. Bye.